In today's video, we're going to show you how to input doctor's orders. So here is our encounter note for today, and then you can go to the bottom of the encounter note, which will have the doctor's orders. So you can click on the doctor's orders button, and then it brings up previous doctor's orders that have been put into the system. So as this one here, you don't see any red, so it means that it's a finalized note, but there's something pending, so you have to address the pending matter. So let's say that in this one, when it was previously ordered that they wanted an OCT of the optic nerve, so you can see that the order date and the plan date, and then the stage. So you can click here, and it brings up different things. So right now it's not started, so that's why it's still present in your view. You can cancel it. If you cancel it, then you can type in a reason and then the provider, and you can hit submit, and it will cancel that order. You can hit in progress or completed, waiting response, or scheduled. So if you hit completed, as you can see, it disappears, so that lets somebody know that the OCT nerve has been completed and no longer needs to be shown as a pending doctor orders. As you can see, these are other orders that are pending, so these were previously ordered on other days, but they were never finalized. And you can see they weren't finalized by the red button still listed here to show that they have not been finalized yet. But let's say we wanted to make a new plan for today, so you can hit the button New, and then you can see it brings up a different window with a bunch of different screens. So the first screen is problem. So you have to pick the problem, which has previously been created from your problem list, but if you haven't created one, you can hit add problem and add problems like you did in the problem list. Or what you can do is you can click an already created problem, such as glaucoma, and this lets them know this is the one you want to create a plan for. So once you click this, you hit create plan. And now you can see that you've opened up a plan for the glaucoma over here. So now there's different sections. So there's care plan, clinical instructions, tests, medications, procedure, and appointment referral. So the care plan has, these are the facility favorites of generated care plans. But you can hit the add button here and add your own care plan. So, and you can make it a favorite if you wanted to, and then save it. But for right now, we can use one of the pre-generated ones. So let's say this is glaucoma and we wanted to evaluate it with test results. So we can click this here, and you can see it auto-generates the evaluate with test results. You can make any additions you want, and hit save and close. So now it will show you your care plan over here, and then you can go on to the next section, clinical instructions. So you can see the different pre-saved clinical instructions here. You can see here from the view, this is the facility favorites. So if the doctor had created their own favorites, you could hit doctor favorites. As you can see, this user had not created any doctor favorites, so that's blank. And then also previous clinical instructions, you can click that there. And if there was any previously clinical instructions given for this patient, they would display here. But for now, we can go back to facility favorites, and we can say, these are just some of the favorites created. So we can say if we were going to perform a procedure, we could click this one and save, and you can see that it shows your favorites here. But let's say we don't have any clinical instruction for this patient, then you can remove it here using the X, and you can see your clinical instructions gets removed. So then you can go to the next section, tests, and you can see there's no favorites created for this, but you can do that all, hit the all button. If there's no facility favorites, no doctor's favorites, and you just want to add something, you go all, and it'll bring up a search screen. So you can search for different numbers. So 92134 is, so that's one of the diagnostic codes for one of the tests. So you can click on that, and then it brings up a body section. So these are the favorite body sections. You can add other body sections if you'd like. So we can put both thighs. It has the provider, the location date, so if you want to change locations, change who the provider should be that is going to read the test. And then for the request date, you can either put today's date. Here's another column if you have within the next month, within 30 days, within 7 days, or if you want to give a monthly value, you can type in 2 here, 2 months, but you can also do days and weeks as well. And if you have any comments for the testing to notify the person that's going to be doing the test of the next visit. So we can say in 2 months we wanted to have this testing done, so we can hit save, and you can see our test has now been added. So then let's say we want to give a medication. So these are for the diagnosis of glaucoma, some favorite medications that had for this facility. But you can go back and search like we have in the past. But let's go to a previously created favorite, and then when you click that here, it brings up your medication screen like you've seen for some of the other videos. So let's say everything is good here. We can add the medication to the order, and you can see now that our medication has been added. And then you can hit procedure, and if there's any procedure that you're going to perform, obviously there's no favorites created for the facility here, but if you had a procedure that you wanted to perform, you could type it in here and add a procedure as well. But let's say there's no procedures for this patient, and then we can finally do the appointment referral. So the appointment referral just brings up a search box. So if you click it, this brings up all of the users that are in this facility, but for whatever facility you have, it would have a different set of users. So you just pick the user that you'd want the referral to be with. So we can say the referrals with Marcus Welby. At the facility, you can change facilities if you like, and then you can put the request date. And it's the same similar button as you had with the testing. So we can say at the same 2 months we wanted to have an appointment as well for that test. And you hit save, and then you've created everything for the doctor's orders. So if this is what you wanted, and this is everything that you need for the doctor's orders, you can hit finalize plan. Or if you're waiting for the doctor to see it, if you're preparing this for the doctor, you can hit save. And as you can see, it saves it here now, but you can see there's the red marks to let you know that it has not been finalized. So if you click this, you can edit it, or you could double click it. So if I double click this here, it reopens it, and then you can hit finalize to finalize the note. And then you can see it brings you a little summary of the medications for any medications that you had put in. And you can see the pharmacy if that had a pharmacy, but we put it for paper. So then you can hit save and close. And you can see that it brings up, since we had it on paper, it brings up a paper medication for you to print, but we're not going to print it today. So now you can see here that the order has been finalized, as there's no longer a red box right next to here to know that this order has been finalized. And then now if you're happy with everything that you've typed in, you can either hit save and close to save everything, or hit cancel. So you can hit save and close, and as you can see, we're back to the screen here. It shows our plan for today that we made, everything that we put in, and then that the order has been finalized because there's no red boxes to show that it has not been finalized. So again, this is how to type in a doctor's orders and finalize a doctor's orders. Thank you.